Please address the chair, name yourself, and please proceed until I have recognized you. Also, you will see the chat function on your right hand of your screen. Please, members, do not use that function for talking amongst each other. That function will only be used once you want to raise a point of order or you wish to draw the attention of the IT or the procedural officer. If there is no objection, members, I would like us to now proceed to observe a moment of silence in remembrance of our two nurses that succumbed due to the COVID-19 pandemic, the late nurses Petronella Benjamin and Ntombika Siti Ngidi. I also wish to, on behalf of the committee, express our sincere condolences to the families of the two nurses and to their friends and all colleagues in the health sector. And I think during this period of reflection, we should also think of all those in service in the sector as well. So if you have no objection, can we please proceed, members? Thank you. Thank you very much. I will now ask members to kindly introduce themselves, and after which the procedural officer can also just indicate whether we have received any apologies for this meeting.
Good morning, Chairperson Lorraine Botha.
Good morning, Chairperson Regan Allen.
Good morning, Chairperson Ricardo McKenzie.
Good morning. Good morning.
Good morning, Chairperson Ayanda Barnes.
Is that all, members?
And then apologies for Member Baku Baku Force Chairperson.
Thank you very much, Member Van Vogel. Also, our thoughts and prayers are with Member Baku Baku Force, and we wish her a speedy recovery as well. Anyone else on the line that or part of the meeting that needs to be introduced, please go ahead. Anyone from the department?
Morning, Madam Chair. It's Dr. Vallabhji here. I'm the Chief Director for Strategy and Health Support. Apologies from our Head of Department, who is busy with Cabinet this morning. She's asked me to represent the department. And I have with me Ms. Leslie Shan, who's from Information Management and will be doing the presentation. And I'll pass some introductory remarks before she starts. Thanks.
Thank you very much. You are most welcome. Also, apology received from Minister Mbombo, who is attending a Cabinet engagement this morning. Ms. Jamke, also thank you to you for your assistance as well. Colleagues, the purpose of this meeting is for the department to brief us on the quarterly reports for the period October to December 2019 and for the period January to March 2020. Can all members see the agenda on the screen? So, colleagues, we will...
Chairperson.
Thank you very much, Member. We will now afford the department to proceed with the two presentations or the presentations, after which member conclusions we will then have an opportunity for questions and answers after the presentations has been done. Is that in order?
Continue, Chair.
Yes.
Thank you very much. We will then ask the department to please proceed.
Thanks, Madam Chair. So we're going to be presenting on Q3 and Q4 of the last financial year, and that then takes us also to comment on achievements for the full year as well. So what we have circulated, Madam Chair, is we have a PowerPoint presentation which really gives us a high-level summary of what the main issues are, It talks about the number of indicators, what we've achieved, what we've partially achieved, what we've not achieved for each of those quarters. And then it then describes what we've partially achieved and what we've not achieved in greater detail with some reasons for that. So that's in the PowerPoint presentation. But what you also have is the detailed spreadsheet that goes indicator by indicator. It gives you the data for all 4 quarters, and then it also gives you the data for the full year. So that's available, Madam Chair. But with your permission, we will focus on the PowerPoint presentation. But if there are any questions on the detail, we're happy to answer questions around that, if that is in order, Madam Chair.
That's in order. Thank you very much.
I'm going to hand over to Leslie Shan, who will show the PowerPoint slides and then take it from there. Thanks, Leslie.
Thank you. Good morning, everybody. I'll try to just share the presentation. If you can just tell me if you can see it.
Yes, we can. Thank you, Michelle.
Let me just see if I can get into presentation mode. Is that better?
That's good. Thank you, Michelle. You may proceed.
Okay, so as Dr. Valabji said, we're looking firstly at an overall summary of our Q3 achievement, our Q4 achievement. And just to note that Q3, we have final data for that. Q4, we are submitting preliminary data at this stage. The final data will only be submitted at the end of May. And then lastly, we're going to focus on just some of the red flags of indicators that we feel at this stage we are unlikely to achieve for 2019-20. So if we look at Q3, we had 68 indicators for that period, and we achieved 50 of those, which is 74%. And then a further 24% were partially achieved and 3 were not achieved. And we'll look at those in detail. If I break it down into which programs they appeared in, you can see that the partially achieved and not achieved are mainly coming from Program 2, our HIV and AIDS, STI and TB treatment services, 2 in our maternal, child and women's health, and 1 from our district hospitals. We also have 2 coming from emergency medical services, and then under Program 7 and 8, we have forensic pathology, our Cape Medical Depot, and our health facilities management, which have only partially achieved some of our indicators, and then engineering services didn't achieve 2 of the indicators. And the same you'll see in Q4, it's similar results. So in Q4, we achieved 76%. Now we bring the indicators increases to 104 because some of these are annual indicators. So out of the 104, we achieved 79. We partially achieved 22, and then there were 3 which we didn't achieve. Breaking it down, again, district health services, there were 12 indicators there that we only partially achieved. Emergency medical services, 2. Provincial hospitals, just the 1. And central hospitals, 2. Our health science and training, there was 1 which we didn't achieve. And then under programs 7 and 8, we had forensic pathology, again, Cape Medical Depot, and the engineering services, and then health facility management. So I'm now going to move on to the what we're predicting for our annual performance. Out of 104 indicators, we're expecting to achieve 82, which is 79%. Probably looking at about 19 that we'll only partially achieve, and then 3 which we won't achieve. That's currently what we're looking at. However, we think that at least 5 of those we will improve on and achieve targets. So we're looking at ending up with about 17 that we won't achieve. So I'm just flagging those 17 indicators, and we'll work through each one of them. The first two are male condom distribution rate and the couple-year protection rate. I've grouped these two together because the reason for the partial achievement is the same. They're both affected by the condom distribution rate. And what has happened here is that initially our central distribution unit was pushing stock down to our facilities in a kind of a push mechanism, and the facilities were ending up with large stock that they were basically overstocked. We changed that process to a pull process where the facilities actually then rather ordered stock as they needed it, as they used it. Unfortunately, our target was set on the push system and not on the pull system. So our target was a little bit out for this year, and that'll be corrected for next year. But we don't, I think that for next year we shouldn't have a problem. Medical male circumcision. So this one has always been a bit of a challenge for us. We struggled to get people to actually commit to being circumcised. The stigma around circumcision remains, and setting a target for this is then very difficult. We are engaging with NPO partners to help encourage circumcisions on the ground. And on a positive note, I must say that since compared to last year, we've had an increase of 30% in our circumcisions. So although we haven't reached target, there's been a positive move in the number of circumcisions that we've done. Moving on to TB and ART treatment. Pretty much the same issues cover both of these performances and services. We have challenges around data capturing. It's a very detailed data capturing, and we're improving the systems around that and the staff to do that. We've also got NPOs which are assisting to capture with us as well, and so we're improving that. We have challenges around managing patients, following up with them. Often the addresses that we have are incorrect or old addresses, telephone numbers change, and then of course we have staff turnover. So keeping contact with patients, especially with our ART patients who are on long-term treatment, is very difficult. We have adopted a 10-point plan from the National Department of Health, and together with our NPOs in the City of Cape Town, we're implementing these strategies within our own context, slightly nuanced within the Western Cape, but there's a team which is responsible for chasing this up. Then we have our antenatal clients start on ART rate. These are our pregnant women who need to start ART. This one has been a bit of a historical challenge. We've found that we have patients who have started on ART previously, have stopped and then restart ART, and this is skewing our performance because we will have restart treatment included in the numerator but not in the denominator. So it's a bit of an anomaly. We've addressed this with the National Department of Health, and they've changed the definition for this indicator for 2021, and so this will be sorted out from next year. So we're not too concerned about this one. We think it's more of a technical issue than an actual performance issue. Then moving on to EMS, our response times for urban under 15-minute rate and the rural under 40-minute rate is below performance. In the urban response rate, the limited responses in the City of Cape Town is affecting the limited resources in the City of Cape Town is affecting our performance. We've worked on various areas around the turnaround time, and we've managed to reduce the mission time, which is on at the scene and then at the hospital emergency centres. We've reduced the time spent at those places. At the moment, our dispatch time from our emergency communication centre remains high, and that's basically due to the availability of vehicles. So until a vehicle is available, the centre is not able to dispatch, which increases our turnaround time then. So this is a volume issue. Then in the rural areas, due to staffing, a reduction in staffing or staff for sick reasons, we are unable to put together an effective or optimal crew for our ambulances. And so what's happened is we've temporarily closed some of the rural stations, depending on whether the staff are available or not, and shifted those services to our bigger stations. This means that the distance for these stations to get to the far outlying areas in the rural areas takes a bit longer, and so we're not able to meet that 40-minute turnaround time. Then looking at our interns that we're recruiting, the one where we struggled with was in forensic pathology services. All the others we achieved, but this one we didn't manage to achieve. And there are two issues here. The one is around the candidates that applied did not meet the minimum educational entrance criteria. And what we're looking for here are matric candidates with pure maths, and we didn't get enough of those. And then we're struggling to get interns to do this work because of just due to the nature of working within forensic pathology services. Okay, then we're moving on to engineering. So this one is looking at the maintenance jobs that our engineering workshops do. And we've had an underperformance here due to our Western Cape supply database that we need to use, and we've also had vacancies within the unit. Then looking at the clinical engineering maintenance jobs completed, again we had staffing issues here. We had vacancies which we have filled with 3 new staff, one which we recruited from our dental unit. And all 3 of these are entry-level posts, and it's going to take some time before they actually reach acceptable efficiency levels. We've also advertised posts, but due to the COVID-19 outbreak, those advertisements and recruitment have been delayed. We've also had delays and non-delivery in replenishing our spares and some of our repairs, and that's impacted on our outputs from mid-January. Then we have child death review boards, which review each child death case in the province. And this year we haven't managed. Our target that we set here was to review every single death case. Unfortunately, we haven't managed to do that, and it's basically due to the volume of cases and the limited staffing capacity. Pharmaceutical stock availability. So there are a number of issues here. Late tender award of tenders by National Treasury. There was a reduced number of pharmaceutical items within these tenders for which bids were received, and then poor supplier performance as it affected the medicine availability. National Department of Health has took over the tender process from the 1st of April, as well as the re-tender process for items. where no bids were received. And delegates from our department are assisting National where possible. And then it was also impacted by the coronavirus in China and India, where we have pharmaceutical ingredients sourced from. Right. The last couple of indicators are around Program 8. And so the first one is the number of health facilities that have undergone major and minor refurbishment outside of our NHI pilot district. We completed work on 26 of the health facilities that we planned for. The remaining facilities we were unable to complete due to slow progress on our design stages, delays and extensions of time for projects in construction, delays in the tender processes, and significant delays on our scheduled maintenance projects and construction. And then looking at the budget spend in Program 8 on maintenance and technology. In maintenance, the underperformance is due to, similar to the previous indicator, slow progress on design stages, delays in tenders, and delays in the construction. We also had challenges with suppliers and contractors in the rural areas, and because there are limited registered service providers in our rural areas. On the technology budget spend, although we've had although in spite of an increased budget allocation, planned over expenditure is forecast to mitigate the strategy as a mitigating strategy to address the under expenditure in other Program 8 components. And by doing this, we then balance out the budget spend within Program 8 between the various components. And those are basically the ones that we are red flagging for now that we're not going to be able to achieve for this financial year, or we're predicting we're not going to be able to achieve. And as I said, the final data will only be submitted towards the end of May. Thank you.
Thank you so much. Thank you very much for presenting. Colleagues, we have some background noise. Can I please ask you to mute your mics? Honourable members, I will now call on you per political party to pose your question. Can we please keep it brief and to the point? Members, also to note that your COVID-19 related questions belongs with the ad hoc committee. So please pose your questions on what was presented to us this morning. I will now grant an opportunity to the Democratic Alliance.
Thank you, Chairperson, Member Botha. Chair, I'd just like to know, with regards to male circumcision and the challenges that we have with TB clients, the ARTs, that challenges that was posed by the department, and I see that they have strategy in place with the City of Cape Town. I'd like to understand what is the strategy pertaining to rural municipalities. Thank you.
Thank you very much, Member Botha. The African National Congress.
Morning, Chair. Chair, can you hear me, Chair?
Yes, please proceed, Member Van Vogel.
I just need clarity. Are we allowed to ask more than one question?
For this round, member, just keep it at the one.
Okay. Mine is just a general question on the COVID-19 question. The report from the with regards to the nurses, if they even can they perhaps tell us the reason why staff protest at Tygerberg Hospital And yeah, just give us a explanation about that event. Then with regards to, okay, now let me keep it there, Chairperson. I just need clarity on that issue. Thank you, Chair.
Member Windvogel, I have just mentioned that our questions will be directed by what we have received and what was presented to us by the department this morning. And obviously the briefing that we have received. I also need to remind members that you also have your parliamentary privileges by which you can direct your questions to the Premier or to the Executive as on a weekly basis. So Member Windvogel, I will not allow that question at this moment. If you have another question that you want to pose, you may proceed.
Thank you, Chair. Chair, I will pose then another question, but for me, it's a burning issue. You can't control us if the fire is burning outside. You are putting us in a box. There's a problem outside, and we need, as the standing committee of the oversight committee, we need to get answers on these issues. But may it be, I will then pose my second question, Chair, of my first question. With regards to Program 8, is there work been done to prepare field hospitals as well as quarantine and self-isolation facilities? What is the number of these facilities in the province and how many people are currently admitted to them? Thank you, Chair.
Thank you very much, Member Windvogel. I'm not disregarding your question as that it is not important. It indeed is. I just want to set the record straight. We also have, after the presentation or the briefing, questions have been posed and the department has answered. We excuse the department by which we as a committee will make certain resolutions and we will speak on the program going forward. So this matter can also be dealt with accordingly then in the same meeting. Member Windvogel, thank you. The Freedom Front Plus. No, good. Al-Jamaa or ACDP, other parties present? None? I will then now allow the department to answer to the two questions. Thank you.
So, Madam Chair, on the question of the TB clients and the antiretroviral treatment, so the issue of retaining these patients in care and the default rates. So, like Ms. Shen mentioned, so there is quite a detailed discussion in the department about this because it does concern us that we have patients who fall through the system, especially chronic care patients. So there's been a lot of discussion about it. It's not only in the city of Cape Town, it is a provincial-wide matter. And we have put a lot of strategies in place. So the first one is the information system. Now we privileged in this province that we have an information system where we have a unique identifier for each of our patients. And so with that unique identifier, we are able to track the patients that come into our system irrespective of which facility they come to. So if they come to a small clinic or if they get admitted into a hospital, etc., we are able to pick up through our data center all of those touch points, all of those episodes. So that really enables us to also pick up which patients are defaulting on treatment or who have not come up for follow-ups, etc. So that's been a big advantage in this province. Now, having had the information, what do we do about it? And like Ms. Shan has mentioned, there are some issues, for example, data-related issues like addresses and cell phone numbers, etc., that at times change, and then we have difficulty in tracking patients. The second thing is we've linked up with our NPOs and the community health worker cadre to follow up these patients. And so the data center can put out a line listing of these patients, say these are the patients that need to be followed up. And then on the ground, these are through our PHC facilities with the NPOs and community health workers, people can do follow-up visits to see what is going on. Can they track the patients and ask them to come back into the service? So that's the work in progress, and it's not really only City of Cape Town. It is across the province. I think what we have to do is monitor this over time and see at the next quarter, etc., whether that is improving. But it is an area that is quite important to us because chronic patients, be they TB, be they anti-HIV patients, the same could possibly apply to diabetics and hypertensives. So we have to strengthen the system in which we are able to retain these patients on an ongoing basis. So that's the answer there, Madam Chair. I think was there a second question, Madam Chair? Sorry, Hello, Madam Chair.
Dr. Vallabhji?
Yes.
The second question was from Member Windvogel. Member, do you mind repeating your question?
Those were COVID related, Madam Chair.
Now, the member raised another question. Member Windvogel?
Yes, Chair, it was in regards to Program 8. My question was, is there work being done to prepare field hospitals as well as quarantine and self-isolation facilities? What is the number of these facilities in the province and how many people are currently admitted to them? Thank you, Chair.
So, Madam Chair, there's been a lot of work being done. I unfortunately have not brought the detail because it was COVID related, so I've not brought the detail with me to this meeting, but we can make that available. But there's been a lot of work being done in terms of triage and testing centers that are being prepared for that. There's work being done about intermediate care facilities at the Cape Town Convention Center, on the R300, etc. But I don't have the detail with me. We can make it available, Madam Chair.
Yes, thank you, Dr. Vallabhji. Member Windvogel, I do believe that we have received some information from the department. We will just, as part of our recommendations and resolutions, just ask the procedural officer just to extend the information again to all members. Any questions from the Democratic Alliance?
Hi, Chairperson Regan Allen here. I'm covered. I'll submit questions to the procedural officer later. Thank you.
Thank you, Member. African National Congress.
Chair, I would like to know, I'm on slide 4, what additional strain has COVID-19 placed on forensic pathology services in the province? Are they ready and equipped to deal with mounting death toll? And what is the department doing to support forensic pathology? That's my first question. Can I pose a second one?
Yes, we are not that many parties present. Please proceed, Member Barnes.
Okay. My second one is on slide 9. On slide 9, with regards to the EMS indicator, I've understood that staff not coming to work due to sickness. Why would the staff are not coming because they are sick, but I would like to know which stations are closed and where are they? What are we actually talking about here in the rural areas? I thank you, Chair.
Barnes, I've missed out on the EFF in the previous round. Any member present? Not.
Chair, may I pose on the forensic pathology as well, please?
Proceed, Member Botha.
I just want to speak to the challenge that we still have in terms of the intake. And I just want to check with the department, our current staff at our forensic pathology services. Are there any of them who are without matric? And Dr. Vallabhji, I think Dr. Vallabhji would remember that we also spoke to this in the last term as the health committee. And Doctor, is there no progress yet as to waiver the maths in terms of the matrics. What is the conversations between the provincial health and national health pertaining to this?
Thank you,
Thanks,
Member
Chair.
Botha. Any other member wishes to pose a question? No questions. The department may proceed. Thank you.
Chairperson.
Chair.
Member Van Vogel. Member Barnes.
Thank you, Chair. I'm on slide 7, Chair. Which ones are expected to achieve the target, and what are the reasons on other 17 that are unlikely to achieve the targets? That's on slide 7.
Thank you, member. The department may proceed. Thank you.
Thank you.
Thanks, Madam Chair. Thanks, members, for the questions. So the first one was about the impact of COVID on forensic pathology. So I think it's a bit early to say. The forensic pathology actually deals with unnatural deaths. So postmortems are done on unnatural deaths. Deaths from COVID patients are regarded as natural. So there is not a direct impact on forensic pathology regarding COVID. But our colleagues from forensic pathology, Ms. Thompson particularly, the director for forensic pathology, is working with local government who has been mandated to manage burials and dissident management for COVID going forward. And there's a lot of work taking place in planning for that. But the direct impact of COVID on forensic pathology is limited because COVID is regarded as a natural death and forensic pathology deals with unnatural death. On the issue of the EMS indicators and which stations closed, Leslie, I think you had some information on that. Possibly you could give the specifics for that, please. And then I'll just take the last one. The issue of the intake for forensic pathology interns and the requirement for a metric. I'll have to get back to you, member. I'm not sure what the status of the conversations are between province and national. I know it was picked up, but I just don't have that information with me, so I can provide feedback to you on that. But Leslie, if you can go to slide 7 and also answer which stations were closed. I think you have the specific information. Thanks.
Thank you, Dr. Valaji. Ms. Shant, you may proceed.
Thank you. The EMS stations that were closed in rural were Bitterfontein, Uniondale, Murraysburg, and then stations in the Overberg district. But I must just stress that these are not permanently closed or closed for an extended period. They're just closed temporarily while we have insufficient staff. As soon as the staff capacity is up, back up again, they are reinstated. But just that closure for a short period of time affects the overall response rate in the rural districts. And then the other question around slide 7, the 17 indicators that we're not going to, or we anticipate won't be achieved, were actually explained in the following 4 slides. Each of those 17 indicators are explained in the slide. Thank you.
Thank you, Ms. Shant. Any other questions from members?
Yes, Chair.
You may proceed, Member Van Vogel.
Thank you, Chair. Chair, mine is just for the sake of clarity, can the department tell us if it is continuing with its work to achieve these targets? It's on slide 4, or things have been suspended to focus on COVID-19. Then secondly, I believe there are budgets and resources attached to achieving these targets. I therefore want to know, has the department prioritized any budgets to the aid of fight against COVID-19? And if not, why not? If so, please give us relevant details. Thank you, Chair.
you, Member Van Vogel. Dr. Vallabhji and Mashant, you may proceed.
So on the issue of the budgets and reprioritization and the impact on targets, so I think definitely I can't remember the dates when the department started to refocus on COVID. Probably early March, maybe end of February. There's been a lot of reprioritization within the department. In fact, we've been so immersed with COVID matters and trying to plan for COVID that just yesterday when our top executive met, one of the issues we did raise is how do we monitor the impact on non-COVID and non-COVID matters. And we kind of resolved that we're going to look closely at the end of the first quarter. So that would be April, May, June. So probably by end of June, beginning of July, you know, what are the indicators showing for non-COVID matters? And we really need to keep an eye on that as well, so that we don't, you know, have serious negative impacts that one is blinded to. So, so there's a lot of reprioritization. We have de-escalated our services. A lot of the elective surgery, etc., has been put on hold. And so we're reprioritizing within our hospitals, etc., to create COVID zones, COVID wards, COVID theaters, etc., so that we have capacity to manage the large number of admissions we anticipate coming our way. So yes, Madam Chair, that's the response to that. Thank you.
Thank you very much, Dr. Vallabhji. I've been covered to a large extent in terms of the emergency medical services. I just wish to ask, what is the department's plan of action? For the periods past, we've already seen the challenge in terms of staff and facilities. And also adding up to is the attacks on EMS staff. So what does the department have in place going on forward?
Madam Chair, I don't have the data with me, but my understanding is the one unintended positive feature of COVID is the trauma and the kind of hijacks and those kind of things have reduced in this period. And I don't have data to back it up, but that's my perception and that's what I pick up, and one can actually go and look at the data. So that's a positive feature, and one hopes then that brings some relief to the EMS colleagues, because if you would recall, they did take the brunt of this violence in townships and hijack attempts, etc. So that's a positive thing on EMS, Madam Chair.
Thank you very much, members. Are there any other questions from your side, or can we conclude?
Ayanda Barnes, Chair. Can I get the follow-up?
Please proceed, member.
Chair, I'm back at the EMS. The question I've asked about the closed stations, I need a follow-up on that one. I'm fortunate to be in Maritzburg now. One, I would like to know the projection, because they said that it's temporarily closed, but for how long, number one. Number two, I would want to know the alternative, understanding that the stations are closed. Where I'm currently at, sitting in a town where a station is closed, the alternative would be Beaufort West, which is 160 kilometers. How is the department handling that? What is the alternative? Can I just get clarity on that? Thank you, Chair.
Thank you, Member Barnes. Dr. Vallabhji.
So, Madam Chair, I think I will get the EMS colleagues to provide more detail on this. So my understanding was, like Ms. Shan has said, that it's because of temporary people being on sick and not having enough crew to maintain the station that this decision was taken. But for exactly how long, I'll need to get that detail back to you, Madam Chair.
Thank you very much, Doctor. Are you satisfied that we deal with that in our recommendations and resolutions, Member Barnes?
Partially, Chair, but I would like to know the alternative. Yes, the time, if I'm not covered, what are we doing in the meantime? Where are people being referred to? How is it working? Can I get clarity on that, please?
Yes, we will direct as such to the department in order to respond to the committee member. Colleagues, if that is all questions, we will now thank you to Dr. Vallabhji and Mashant for briefing us this morning, and thank you for answering the questions. We will, of course, deal afterwards with follow-ups that may occur. And again, we may now excuse you, and before you do so, wishing you all the best in your task. And thank you for all that you do in terms of our health services in the province. Thank you very much.
Thank you, Madam Chair. Thanks, members.
Thank you, Madam Chair.
Members don't leave as yet. Can we perhaps just take a quick stretch of the legs for 5 minutes, members?
Okay.
Agree.
Okay.
Yes.
Members, we are back. Members, it is now 9:52. We will now proceed.
Okay.
Thank you, Chair.
Thank you so much. Members, we will now deal with committee recommendations and resolutions. Is there anything from your side?
Chair, I trust that Nomonde has taken the note from Dr. Vallabhji to come back to this committee with regards to the forensic pathology services and the engagement with the National Department of Health around the status of where we are.
Ms. Jamke, can you just confirm that, please?
I have noted 2 resolutions, Chairperson. The first one is the department to give a detailed information on the progress made to waiver METS on the intake of forensic pathology interns. So I don't know whether I have captured that correctly, or maybe Member Porter wants to give me a wording. The second one was, what are the plans of the department that are in place to assist patients in rural areas with EMS service in areas where EMS station had been temporarily closed? So I think that one was from Member Barnes. So I only managed to jot down the 2.
Thank you, Ms. Jamke. Member Botha, are you satisfied?
Yes, Chair, it's fine.
Thank you very much. Member Barnes, are you happy in terms of the EMS?
I'm happy, Chair, but I would also like to add, because I've asked about the time frame, the projection, how long it will be.
Okay, that will be added. Thank you, Member Barnes. Member Van Vogel.
Yeah, Chair, I'm not satisfied with my question on the facilities, quarantine facilities. I want that in the different districts. We need that information. If I even go on Google and check on those information, it's just not satisfied for me in terms of, I want to know in Swellendam district of, let's say, Overberg district, so many quarantine sites is available, and in this Overstrand, so many, something like that. You are saying you already say the information, but it's not for me clear in terms of where those quarantine sites and in the different districts. Thank you, Chair. I need you will know how to formulate that. Thanks, Chair.
Thank you, Member Van Vogel. What I've said on various platforms, this information has been shared, but we can ask that the department provide us with the information as per district. As requested, please, Nomonde.
Noted, Chair.
Thank you very much, members. Member Allen, was there something from your side?
No, I am covered. I am going through the information that Nomonde sent, and I will submit questions to her. Do we have a deadline for that?
Today at 4 members will be the deadline. And then also, if there's no other recommendations and resolutions, member, we also need to agree on our program for next week, agenda points for next week's meeting. If members do not have it available at this moment, can you please send myself and Ms. Jamke an email by today at 4 on your proposed agenda points for our next meeting, please? Is that in order, members?
Yes, Chairperson.
In order, Chair.
Thank you very much, members. Ms. Jamke, is there anything else from your side?
Nothing, Chairperson, just the program. That is a pending issue because next week we're supposed to schedule a meeting, and there's nothing on the program. We only have oversight visit, and we all know that we cannot do oversight during this pandemic. So we can only schedule the virtual meetings, and unfortunately for Standing Committee on Health, there's nothing scheduled for next week because we don't have agenda points.
And we will definitely attend to Ms. Jamke. Thank you very much. Members, can I please ask you to please respond by today at 4 or at your earliest convenience before then. Members, if there is nothing else, Ms. Jamke, thank you very much for your support and assistance today. Members, thank you so much also for your attendance. If there's nothing else, you must have a lovely and a blessed day. Please do keep safe to you and your families. Then this meeting is now